I immediately went into hustle mode. I immediately thought I better get out there.
It's a day you can't fully prepare for, and one you hope will never come. What followed on August 3rd were 28 hours trauma surgeon Dr. Susan McLean won't forget.
I immediately thought, what am I going to have to do to get this done?
Split-second choices with life or death consequences. It's no wonder El Paso psychiatrist Dr. Sarah Martin says it's not uncommon for some medical professionals to temporarily place emotion to the side.
The first instinct and the training really supports just getting the job done.
Dr. Martin says for some first responders, the weight of the experience might not set in until it's over.
It's different for different people, but in general, when you've been through something like that, you are changed in some way forever.
For Dr. McLean,
I went up to ICU after we had made our rounds, after we had done all the surgeries. I sat down and I turned to my resident who was in ICU and I said, hey, can you believe what's happening here in El Paso? And she looked at me and she said, no, this is surreal. That's the way a lot of us felt, that it was not real.
that processing continued outside hospital walls.
So what I did do was go out to the memorial at the Walmart. There was a sense of unity. Like a lot of community members had done beautiful art. Going there and then looking at all the white crosses, seeing the flowers and seeing all the memorials that people had made. I think that's when it sunk in to me more as a citizen and not as a physician taking care of patients. And I remember walking away and I felt really somber. I kind of weighted down. It's like, wow, this was so huge. So many people died. So many people were injured. And it just seemed, it didn't seem surreal as much then. It seemed more real.
Now El Paso's medical professionals are on the front lines yet again, this time in their fight against COVID-19.
People are exhausted. Everything takes longer, and so that's more time spent working and less time spent resting, which is hard on people.
Dr. Martin says healthcare workers can find strength knowing they're making a difference.
It's amazing what people can get used to and what they can adjust to. So I really think that the vast majority of people will be able to function well throughout the whole pandemic, even if they've been through hard things before, especially if they see the work they're doing as important and valuable to others.
For Dr. McLean, the patients she helped save on August 3rd remain a source of hope.
All of them worked very hard to get better. Those people, despite everything they had gone to, were just so resilient. I think over the past year, I learned that we can come together as a team. Like, I definitely couldn't have taken care of all these patients, and not any one of us could, but together we could.
Madeline Ottley, ABC7.